Hi, this is Doc Rob Sivis here again with another episode of the Carb Addiction Doc. I know today's title is very controversial. Part of it is because I'm a doctor. Not only am I a doctor, I'm a doctor. I've got an MD and a Ph.D. degree. But why is it that with all this healthcare expertise, with all this wonderful science or pseudoscience and knowledge, we as a society are getting sicker and sicker and sicker and actually dying earlier, not later, as a society? Why can we doctors not take a leadership role in really identifying the cause of why we are truly getting sick and dying and deal with the cause rather than just put band-aids on the consequences of that cause? People are dying most commonly from what they out there call the consequences of obesity, obesity-related comorbidities. And you know what? Nobody dies because they're fat. Nobody dies because they're fat. Very few people fall over and die because they can't get up, they're so big. It can happen from time to time, but we don't die because we're fat. Right there is cognitive dissonance. The commonest cause of death in the United States of America is chronic excessive carbohydrate consumption. The commonest cause and associated causes of death in this country is chronic excessive carbohydrate consumption. Whether it's a heart attack, whether it's a stroke, whether it's cancer, whether it's an inflammatory disorder, whether it's a consequence of diabetes, whether it is fatty liver disease, all of those are directly a result of chronic excessive carbohydrate consumption. And yet we still haven't put two and two together. I am embarrassed to say that ironically, the people that are leading the charge on this are non-doctors. They're non-doctors. If you look in the ketogenic space, who are some of the thought leaders out there? Ivor Cummings. Ivor Cummings is a beautiful Irishman. He's the fat emperor, but he's an engineer. Dave Feltman understands cholesterol. He understands lipids. He's not a doctor. I think he's a computer software engineer, but he tells a compelling story. And then a friend of mine, a child psychiatrist who's kind of left the clinical field for a variety of different disgusting reasons, just disgusted at healthcare, Richard Margolis, introduced me to a woman by the name of Shannon Brownlee. Shannon Brownlee, her expertise is on deprescribing. How do we help people to come off their medications? And guess what? She ain't a doctor. She's an author. Nina Teicholz, Gary Taubes, both authors and non-medical professors, non-doctors, are raising our awareness of what's killing us because we doctors are stuck in a hole with our heads up our ass about carbohydrate addiction. So the irony lies in the fact that it's taking lay people to lead the charge on healthcare because doctors refuse to do it. When an endocrinologist tells you you have to eat carbohydrates and then use insulin to control your blood sugar, how upside down is that? Because if you don't eat the carbohydrates, you cannot have type 2 diabetes. And yet the American Diabetes Association has close to 99 drugs for the treatment of diabetes, not to remission, but to control your blood sugar. But nowhere on their page are they willing or able or even think about saying that if you don't put carbohydrates in your face, you cannot have type 2 diabetes. What are we doing, doctors? So let's talk about deprescription. If carbohydrates are a drug, and they absolutely are, by every definition of drug, whether you use alcohol, whether you use morphine, whether you use crystal meth, crack cocaine, heroin, carbohydrates follow exactly the same ICD-5, ICD-10 diagnostic criteria. Carbohydrates are a drug. We just haven't connected the dots yet. We called obesity a disease before we called carbohydrate addiction a disease. 2014, the American Medical Association labeled obesity as a disease, but we still can't come to the terms of carbohydrate addiction. I have. Who else leads the charge? If I look on my Instagram feed, if I look out in the population out there, all the keto people, all the people understanding what I'm talking about, the majority of them aren't doctors. And when a certified diabetic educator says, wow, I understand that a low carbohydrate diet is a healthy way to treat diabetes, he or she can lose their license, their CDE status, if they recommend a low carbohydrate diet. I was talking to a patient yesterday, type 2 diabetic, and their doctor still tells them to eat 50 grams of carbohydrates with every meal, because if you don't, your blood sugar is going to go too low because of the insulin you're taking. How screwed up is that? So the amazing thing is that the charge of protecting and improving our health, the healthcare charge, is not being done by doctors. We're actually retarding it. When we put every patient on a statin, but we don't understand why, we're actually killing patients, or we're allowing patients to continue to kill themselves by not highlighting the dangers of carbohydrates, sugars, and starches in the modern American diet. Just like doctors may fret and fret and fret about, oh, this vaping is a bit of a problem, and there are a couple of people die. Why the hell have we not come out and adamantly said that vaping is an awful thing? Why the hell, after 70 years, are we still able to sell cigarettes? And why does it take Ivor Cummings, Dave Feltman, Nina Teicholz, Gary Taubes, and Sharon Brownlee to help us to deprescribe medications and understand that the commonest drug in our society right now, carbohydrates, need to be deprescribed from the American population, along with nicotine, irrespective of what form it takes. You eradicate those two drugs from our society, and we will have a healthy society. Isn't healthcare all about health? Apparently not. So let's talk about deprescription. Deprescribe your consumption of a drug called carbohydrates, and you will then successfully be able to deprescribe all the drugs that are related to the diseases caused by carbohydrates. You'll be able to come off all your diabetic medication. You'll be able to come off a lot of your high blood pressure medications. You'll be able to stop that statin that isn't really of great value to you. Think about this, and this is kind of an area that Sharon Brownlee goes into. Think about the number of people that are on psychotropic drugs. Think about the number of people that are on antidepressants and other drugs that stabilize, that help our heads. Why? Yes, there's some organic diseases like bipolar disorder. I understand that. And those people need to be on their medication. If you've got schizophrenia, those medications are really, really good at helping you to manage your schizophrenia. But the overwhelming majority of us on mental health drugs are there because nobody has sat down and helped us to develop an effective, healthy, diverse emotion management system. And if we could focus more and more on healthy emotion management behavior systems, we'll be able to deprescribe those drugs very effectively. But part of the problem is doctors put you on medication without ever considering the fact that you might be able to come off those medications. There are extremely few endocrinologists out there that are willing to even consider the concept that you might be able to put your type 2 diabetes into remission. What they do is they just keep throwing more and more medications at their patients when their insulin resistance becomes worse and worse and worse. And eventually, even the type 2s have to be supplemented with insulin directly, to which they become resistant. The psychiatrists, the family doctors, whenever someone's depressed, they don't say, why? How can I help this person's depression? They throw another medication at you. We have become not doctors, we've become prescribers. And we prescribe pills to take care of problems we refuse to consider the cause of. At what stage is our society going to topple over because of that? It is very, very, very rare for me to see a patient in my office, even my adolescents, even my kids, who are not on a medication. I'm on none. Now, some of you might say I need several medications, but yeah, I'm on no medications. And the reason I'm not on any medications is because I'm not doing the things that make me sick. I have deprescribed carbohydrates, and therefore I don't need any of those other prescriptions. I don't need mental health drugs. I don't need diabetic drugs. I don't need statins. Am I going to die? Of course I am. Of course I'm going to die. But I'm going to probably get hit by some arsehole driving a car and texting. I'm going to get hit skydiving while my parachute doesn't open. I'm going to die probably, and I hope, from things I love to do. I don't want to die of cancer, of a heart attack, of a stroke, of an inflammatory disorder. And I'm in charge of how I die. I would love for my patients to be in charge of how they die. And I don't want them to die because of a drug called carbohydrates. Die doing something that you love to die from. Die of something that you get to do for pleasure and for passion. Don't die of a drug or a drug overdose. And the commonest overdose in this country every single day is overdosing on sugar and starch. And it's killing us. And our doctors do not understand that. Thank you, Shannon Brownlee. Thank you, Ivor. Thank you, Dave Feltman. And I'm just mentioning a few. There's another guy, Dr. Iridosi, Gabor Iridosi, not a physician, not a medical doctor, but he gives some great talks out there about how our food is killing us and how our transformation of that food is killing us. Why is it that all these non-doctors understand healthcare better than MDs and DOs?